I don't think we have to go that far. But anyway, with that, may I ask the first presenter, which is it's a paper on effectiveness of assisted Thera-band resistance exercises on improving the swing phase of gait in hemiplegic patients. RAD Kularathna and J. Wanigasinghe. Mr. RAD Kularathna is a demonstrator in clinical sciences stream in the Faculty of Medicine, University of Colombo. Over to you, Mr. Kularathna.
Good afternoon. My topic is the effectiveness of assisted Thera-band resistance exercises on improving the swing phase of gait cycle in hemiplegic patients. And those are my outlines of my presentations and introductions. The ability to walk independently is the main activity of a normal human being. You already know the movement of from place to another plays an important part of humans' daily lives. We want to move. Without movements, we can't do anything. For every patient who is suffering from hemiplegia, restorations of walking is important. Restorations of walking is important. In here, patients with hemiplegia presents with an inability. Normally, patients with hemiplegia, they present inability to inability to dorsiflexions of ankle and knee flexions. Due to that impairments, their movements are reduced. It results in circumduction movement of affected lower limbs with limitation of their walking abilities. Their walking abilities are limited. If we improve their dorsiflexions of ankle and knee flexions, then they can prevent circumduction movement and gain their normal walking patterns. And here you can it is not a cartoon, that pictures. This is a healthy man after his sudden get a strokes. That man will be chair-bound or bedridden. That means lack of movement. Then after, as a physiotherapist, we have to now in Sri Lankan government sector and private sectors, we are following normal conventional gait trainings, gait training programs. So then after weeks, months or years, that patients gain his normal activities of daily living. I'll show you one story. Think about, today I am here with confidence because when announcing my names, I walk from that chair to here with confidence, because when I am walking, anyone didn't give me any attention, didn't give any care, because I am just a common man. I'll show you one thing. If I walking from here to there, like this movement, so what about your feelings? You will give your attention to me because I have normal activities of daily living, but I am different from pattern of walking from you. Is that true? Then I wanted to change that view. So I choose new techniques to prevent that deformity. That's the my main opinions of my research. And then shall we turn our eyes to the literature review? Research in American Academy of Neurology Journal suggests strokes are becoming more common at younger age. And here study in American Heart Association Journal suggests that the gait hemiplegic stroke patients is generally greatly disturbs their extensor muscle. Actually, there are some muscles impairment. Muscles are not paralyzed, but there is some impairments. In third one, the study has suggested that early rehabilitation interventions might explore that here mentioned. Some studies have conclude they can, as a physiotherapy, we can gain normal activities of daily living if we select the rehabilitation programs in correct time. The recovery will enhance at early rehabilitation stages. And it is a controversy whether resistance exercises are good or bad, necessary or bad for upper motor neuron lesions conditions. But in this study shows muscle training regimens results in increase in strength and in functional activities such as walking and other things, other standing and other movements, day-to-day activities. And second one, strength training can improve upper limb strength and function without increasing tone. If you are good skilled physiotherapist, you must know how to maintain the muscle tone when you are using strengthening exercises. So this is a special literature review. The Korean study, I found that one is very close to my study, but unfortunately I can't found English translated full text article because it was very difficult to translate from Korean language to English. And those are my objectives to describe the effectiveness of Thera-band resistant assisted exercises. For I want to measure the effectiveness whether conventionals or Thera-band resistant Gait trainings good or bad. Next one, to identify awareness of Thera-band, and those are my methodology. This was randomized control interventional study, and those are study settings, and I study populations for 60 patients with hemiplegia, and age inclusion. I have inclusion criteria and exclusion criteria. Mainly, I want to tell you the in inclusion criteria, disability score. That mean I'll explain in the next slide. The median Wisconsin Gait scale, and data collections by Wisconsin Gait scale and questionnaire. And here this is the Wisconsin Gait scale. Here the highest score 42 means more seriously affected, and 13.35 means normal healthy persons, and middle one, median Wisconsin Gait scale. My selected populations located within that 28 to 48. Then if after my treatment plan, if they improve their gait, so their scores gradually reduce. So study procedures, I selected 60 patients and divided into two groups, one control groups and intervention groups. So I pre-assess by using Wisconsin Gait scale. Then score all you can see the mean score, pre-score 36.2, 36.5. That's approximately equal. That means gait impairment, both control groups and intervention groups equal. Then exercise programs, I followed exercise programs. Control groups, normally conventional gait training, and interventional groups, conventional gait training by wrapping the Thera-bands. That was the special techniques I have used. Gait training programs for both groups was conducted in 45 minutes, 3 times per week, around throughout the 2 months. And here these are the methods of wrapping the Thera-band. I can't explain all the way of the wrapping it. This allowed to patient to hold it in unaffected hand or directly or turning around the necks and moving down to the holes by the unaffected hand. And data analysis by SPSS package and socio-demographic data and other awareness of Thera-band assisted exercises. Questionnaire was assessed by frequency timetable and charts, and normally distributions of pre and post scores was normal. So I used parametric test, and here's my other analysis, main analysis. Pre and pre scores of both intervention groups and control groups, and pre and post scores of control groups, and here other scores. Those are my results. Mean age of participants were 50 6.28 years at the time of study. Majority of participants were well educated and well earning, but they are doing desk jobs. I will explain later. 70% of participants were heavy smoker, and majority of participants were lack of awareness of Thera-band. They don't know about the Thera-bands and techniques of the physiotherapy. So here's some. You can see this table, and this is the main chart. You can see control groups, pre-scores and intervention group pre-scores approximately equal. Then post-score of the control groups reduce 6 to 34. Then interventional groups 36 to 35. They all are significant. Both treatments shows improvement. But here you can see the difference 36 to 25. That means individual mean difference 10.777, and mean difference between differences are significant. And my conclusions, according to the results, both conventional gait training and assisted Thera-band gait trainings are effective for hemiplegic patients. It is true, but assisted Thera-band assisted exercises training programs more effective becomes recover in a shortest time period without deformity. Earlier I explained about the circumduction movement. It is suggested that both improvement of patients actually awareness of their disease and application of new technique. If we are applying new techniques, we should improve the awareness of the patient. Unless we can't gain our achievement. And here my recommendations and limitations. These gait training methods will be effective not only acute male patients, because of chronic patients, and it is essential to make the adult aware. I earlier heard if we use new techniques, we should increase the patient both awareness. And when the other researchers follows investigation related to the hemiplegic, should need to consider patient's psychological state at the time of assessing of the gait. Thera-band exercises also may be effective for upper limb functions. So you can use those techniques for upper limbs and other trunk movements to improve trunk movements. And this is the it's proud to be say 70% of heavy smokers, majority of participants were doing desk jobs, and their physical activities poor. Physical activities poor. They are heavy smokers. So these people in Sri Lanka were more prone to suffer from strokes or transcranial ischemic attacks, TIA, and think. Those are my references. Thank you.